will be presenting our group strategic plan for special topics in healthcare management. Well, our group members are Anshuman Apu, Muhammad Ahmed Jan, Luis Martin, Sanjita Nausin, Nidhi, Sanai, Krishnavi Somapali, and Danish Wahid. Together, we developed a strategic plan for a regional general hospital. Well, our plan focusing on creating a healthcare organization that is proactive, resilient, and prepared for major challenges facing healthcare managers today. Well, our proposed organization is a full-service, non-profit regional hospital serving both urban and surrounding rural communities. Well, the hospital will use a matrix organizational structure, which allowed departments such as nursing, physician, administration, IT, and finance to maintain their specialized responsibility while also working collaboratively. Well, our strategic plan primarily addresses two major challenges. First is the recruiting and retaining healthcare staff, and second is the rise of the cybersecurity threats. The overall goal is to be proactive. Instead of waiting for staff shortages or cyber attacks to become a serious problem, our hospital will develop systems to prevent, identify, and respond to these risks as early as possible. Well, this slide summarizes our strategy in three main areas: the hospital model, workforce system, and cyber resilience. First, our hospital model is a non-profit regional hospital providing inpatient, outpatient, emergency, surgical, specialty behavioral health, telehealth services as well. Telehealth will be especially useful for reaching patients in surrounding rural communities. Second, our workforce strategy includes creating a regional workforce pipeline through partnership with colleges and healthcare training programs. We also propose a career passport, which help employees track their professional development and opportunities for advancement. To improve employee retention, the hospital will also offer flexible scheduling, competitive benefits, mentorship, and internal career opportunities, along with stay interviews. Stay interviews will help management understand employee concerns before employees decide to leave the organization. Third is the cyber resilience. Our hospital will use zero trust security, multi-factor authentication, and network segmentation to protect hospital system and sensitive information. We will also establish a digital safety champions across different departments to promote cybersecurity awareness, continuous monitoring, and secure backups, along with incident response plan and cybersecurity simulations, will also help prepare the hospital to respond effectively if an attack occurs. Well, the main idea behind our strategic plan is to build resilience into the organization before a crisis occurs. By developing and retaining a strong healthcare workforce while also creating a secure digital environment, our regional hospital can provide safe, reliable, and patient-centered healthcare to the community it serves. Thank you for my part. Now we will move towards the third slide in our next.
Hello, my name is Nidhi Rugnabhai Rabari, and today I'm presenting slides 3 and 4. So, first of all, we are going to discuss our hospital's mission focuses on what? So, our hospital's mission focuses on safe, compassionate, accessible, and technologically secure healthcare. We also want to support the professional growth of our employees. Our vision is to become a trusted regional health system known for quality, innovation, community partnership, cybersecurity, and workforce excellence. Moving forward to the next, we are processing a full regional continuum of care. This includes emergency and inpatient services, surgery, primary and specialty care, imaging, pharmacy, behavioral health, rehabilitation, prevention care coordination, and telehealth. By connecting these services, the hospital can provide both routine and advanced care while improving access for all. Thank you.
Hi, my name is Anshuman Baolopu. Now I am going to talk about why a matrix structure. So, Uh, a hospital is a complex organization where many departments need to work together. Our hospital includes specialized departments such as medical, nursing, human resources, finance, IT and cybersecurity, quality and safety, operations, and community outreach. Each department has its own responsibility, but they also work together through cross-functional teams. These teams focuses on areas such as clinical services, quality improvements, strategic projects, and cybersecurity. For example, improving patient care is not only the responsibility of doctor and nurses. IT operations, quality, and administrative teams may also need to work together. Therefore, a matrix structure helps provide faster coordination, shared accountability, better patient uh, flow, stronger risk response, and specialized exercise. Now I'm going to the next slide. Uh, yes, so at the top of the moving to the slide 6, this slide explains our leadership and accountability structure. At the top of the Uh, at the top is the board of director, followed by president and CEO. Under the CEO, different executive leaders are responsible for specific areas. These include the chief medical officer, chief nursing officer, chief operating officer, chief financial officer, chief human resource officer, chief information officer, chief information security officer, along with leadership and quality and safety and strategy and community. Although each leader has specific responsibility, they work together to achieve the hospital's overall goal. In summary, the matrix structure promotes teamwork across departments, while the leadership structure provides clear responsibility and accountability. Together, they help our hospital provide safe, efficient, and high-quality patient care. Thank you. Now I will hand it over to the next presenter.
The problem shown on this slide is associated with current human resource practices and the necessity to make changes to reduce turnover. In this slide, you can see there is a vicious cycle in which open positions and the corresponding recruitment efforts lead to staff exhaustion, which can cause more staff members to leave their jobs. Therefore, it is important to change the cycle from recruitment as an end goal to building human resource sustainability through the holistic consideration of the issue. It is also essential to optimize the workload, provide flexibility, and promote staff development as well as their overall wellness. By doing this, it will be possible to ensure human resource sustainability and have a deep talent pool that will contribute to the overall organization's success. On this slide, we map out our continuous pathway from education to long-term internal growth. It begins with establishing strong regional partnerships with local universities, nursing schools, and community colleges. From there, we attract top talent using competitive rewards, internships, residency programs, while offering immediate operational support through flexible self scheduling options. To ensure long-term retention, we support our staff's development through the Career Passport and mentorship programs while enabling internal mobility using an internal talent marketplace. Finally, we protect the staff's well-being by using a stay interview to retain our workforce. Overall, this represents a beneficial shift moving away from the costly vacancy recruit replace cycle and committing to a strategy where we can develop grow, and retain our people.
Hi, this is Krishna. Slide 9 shows how we measure the strength of our workforce using a clear scorecard, which track key indicators like turnovers or vacancy rate, time to hire, overtime agency, labor and like internal promotions and stay interviews. And in 1 year, our goal is to build a solid baseline with at least like 80% of the employees having development plans. And year two, we aim to reduce voluntary by 10% compared to that baseline. And by the year three, focus on the internal mobility, filling 30% of the eligibility roles from within or reducing reliance on agency staff. And overall, this slide indicates structured, measurable path toward long-term workforce sustainability. And here goes the next slide. This slide shows like how the patient safety is related to the cybersecurity and how critical systems like EHR. I think EHR is like health record number of the patient and the medication system, lab and imaging, medical devices, telehealth, cloud platforms on the patient portals depends on like strong cybersecurity protection. Threats such as like ransomware, data breaches, and downtime can interrupt care and compromises sensitive part information. A cyber incident can delay treatments like block access to records and reduce patient trust. This slide reinforces that cybersecurity isn't just an IT concern, it's essential for safe, continuous, and reliable clinical care. And by the way, where I'm working in like a niche right now, and there the work related to the patient health records where I secure the safety with the like age, sex, and like what the diagnosis they have, and probably um, like insurance. And I used to work with the ECW where like clinical works goes on like the clinical records where the agency is. Now I'm like
Good morning, everyone. My name is Danish Wahid, and I'm a member of our group presenting the strategic plan for Regional General Hospital. So, for my part of the presentation, I will be discussing the hospital's cybersecurity strategy and how Clear Reliance can support patient safety and continuity of care. And as a healthcare organization become increasingly dependent on digital system, and cybersecurity has become like important part of healthcare management, and hospital rely on electronic health record, medications systems, laboratory imaging, telehealth, and patient portals. So therefore cyber attack can affect not only information systems but potentially the delivery of the patient care. Our strategic plan to address the challenge through a cyber reliance and digital safety network. So in this slide, this network has several layers of protections. First, you need to identify the security includes zero interest, list privilege, success, and multi-factor authentication. And the people component is and the people component is also very important. So cybersecurity participate in simultaneous through digital safety and champion. Like continuous monitoring helps detect secure backups and incidents response planning and recover from the disruptions. So so moving to the next slide. And next slide, the next part of cyber incident readiness cycle. The purpose of this slide is to prepare clinical teams to continue providing safe care even when technology is disrupted. So the first stage is prevent. We use zero trust multi-factor authentication and employee training to reduce possibility of an incident. And the second stage is detect, as you see in the presentation, as in the slide. and which includes monitoring, alert, and escalation. The third step is respond. During an incident, the organization needs to contain the problem, activate downtime procedures, and communicate effectively. And the fourth stage is recover, like secure backup and define recovery objectives, help restore critical system. Finally, the fifth stage is learner. After an incident or simultation, the hospital reviews what happened and identifies opportunities for improvement. Uh, in the last, to strengthen this process, our plan also includes cyber reliance simultation lab. This would allow clinical teams, pharmacy, IT, cybersecurity executives, and quality staff to practice responding to the situations such as ransomware attacks and EHR downtimes and major technology outgates. Overall, our goal is not simply to prevent cyber attacks, but to make sure the hospital can continue delivering safe patient care when a disruption occurs. Thank you very much.
So the plan distributes accountability across the board, CEO, HR, cyber leadership, clinical executives, and department managers. Major risks and addressed through phase implementation, employee involvement, clear responsibilities, and regular review. So during the execution phase, we can split this matter in three major pillars. So the accountability will be more directly to the board about strategy and risk. The CEO have a major function of oversees the overall implementation. The HR, we're gonna make sure you will have the workforce strategy. The cyber leadership, we're gonna prevent and damages and digital security. Clinical executives will focus more on patient care impact, and the managers will guarantee the operational execution. Okay, the major risks will be the financial investment, be a lot of overhead on this type of high A players employees. Will be employee resistance, matrix hole confusion, workflow disruption from controls, workforce competition, involving cyber threats. About the review, so monthly, the operational managers are gonna make a report. Quarterly, it will be more the executive team in the board, and annually, we're gonna make a strategic review. So the programs continue, change, expand, or stop based on evidence. About the outcomes, you can expect the strategic outcomes, okay? What success would look like. At the end, you're gonna have a stronger recruitment and retention. You're gonna have a safer, more continuous care. We're gonna have fewer cybersecurity disruptions. We're gonna have a regulatory compliance. We're gonna have lower burnout and turnover. We're gonna have better protection of EPJI. Also gonna have higher patient trust and satisfaction, and of course, long-term financial sustainability. Okay, so a resilient hospital where workforce excellence and digital safely reinforce patient-centered care.
Hi, this is Sanjita Naushin. Thank you, my teammates, to give me this opportunity. Today, I am telling about the strategic plan for Regional General Hospital. My part is conclusion. So today I am telling about this conclude. So my part is in this conclusion, the Regional General Hospital brings together work